Good afternoon. We'll welcome folks into the Zoom room with us and give folks a moment to get logged in. There's always this moment of transition as we begin the webinar and let participants file in. As we do that, I'll introduce myself. My name is Karen Odegaard. I am the External Affairs Liaison here at the Department of Health Services, and I'll be moderating today's budget briefing on addressing staffing and workforce needs across healthcare sectors and investments in long-term care. Let's see. Oh, and I'm seeing that our slide that you're seeing in front of you, apologies, that does have a misnomer in case you wondered if we had gone back in time. We have not. It is April 3rd. So thank you for joining us today on this Monday afternoon. Before we dive in, I did want to let you know that we are recording today's briefing, and we'll provide a link to the recording and slides from today for those who have registered. Please use the question box to ask questions during today's briefing, and we'll leave time at the end for questions as we have them. We may not be able to answer all of your questions today, but we will try our best to follow up with those whose questions aren't addressed during our time together. Our speakers today are Secretary Designee Kirsten Johnson, our Legislative Director, H.J. Waka, the Division of Care and Treatment Services Administrator, Ginger Steele, and the Division of Quality Assurance Administrator, Otis Woods. I am pleased now to introduce the Department of Health Services Secretary Designee Kirsten Johnson to kick us off today. Secretary Johnson, let me turn things over to you.
Thank you, Karen. Hello, everyone, and thank you for being here. My name is Kirsten Johnson, and I am the Secretary for the Wisconsin Department of Health Services. I'm excited to be here with you. Governor Evers' 2023 to 2025 breakthrough budget for DHS leverages Wisconsin's unprecedented surplus to make substantial investments in Wisconsin's healthcare, behavioral health, public health, and long-term care systems, as well as initiatives to advance equity and reduce disparities in our state. For our partners joining us today, we are so appreciative of your support to ensure this budget helps build a healthier Wisconsin. Thank you for the tremendous amount of work you do every day to protect and promote the safety and health of Wisconsinites in your communities. We need to ensure every Wisconsinite and every community has the support provided in this budget to invest in our working families and drive economic growth. Good health is essential for everyone, and Governor Evers is dedicated to preserving and protecting the health of Wisconsinites throughout the state. Before we go into details of what's in the budget to support these initiatives, I will turn things over to H.J. Waka, our Legislative Director, to talk more about the budget process. H.J.
And thank you, Secretary Johnson, and thank you, everyone, for taking the time out of your busy days to hop on the call and on this briefing with us today. So before we get started, we wanted to kind of start with a high-level overview of how the state budget process works and where we are currently at in the process. Next slide, please. So some of you have heard me say this before, but I always like saying, because I think it's incredibly true, is that the budget never ever really stops. It is a constantly ongoing process and cycle. And so where we are at right now in this cycle is in that little yellow arrow at the bottom of the cycle there. That's where we're at today. So where we started was at the top, was at that red arrow. That's when the old budget is signed, and then we start working on the next one. We've already had our agency submissions and DOA, as well as the governor putting his budget forward for consideration to the legislature. And that's where we find ourselves today. Is the budget is over. We're working with members of Joint Finance. I know many of you who have joined the call today are also engaging with members of Joint Finance to further advocate for the initiatives that are in Governor Evers' budget for the 2022-2023 biennium. Once we get through that, we'll start moving, as we move into the next of the process, starting this week, the Joint Finance Committee is starting their roadshow, at which point they'll go around the state and hear input from members of the public. And then starting, late April, early May is when we'll start getting into some more of the executive sessions of the budget. And then towards the end of May, beginning part of June, the bill will move out of committee and then onto the floor for a vote and then signed by the governor sometime, ideally, late part of June, early part of July. But want to emphasize right now is a critical time in this budget process, because now is the time to be advocating for the governor's initiatives in front of the members of Joint Finance as we find ourselves in that little yellow arrow at the bottom of the cycle. So next slide, please. And I know I mentioned, briefly mentioned the Joint Finance Committee Roadshow. This is where the committee goes all around the state, listening to in-person meetings and hearings, soliciting input and feedback from members of the general public. That starts this Wednesday in Waukesha, and then they're going to be in Eau Claire and the Dells next week. And then at the end of this month, they're going up to Minocqua to hear from folks in the general public. So if you haven't done so already, I highly recommend you check it out. That you go and show up either yourself or your members or your stakeholders or your partners to go and make sure that your voices are heard in those public forums and those public settings. And can't emphasize that this does matter, and it's a good time to engage, to put a different face in a different forum than what some members of Joint Finance are used to. But any time spent in front of the committee is not wasted, and I want to encourage both you and your folks to get out there to make your pitch, to make your voices heard as we move forward with the Governor Evers budget for this session. Next slide. So what is in Governor Evers' budget? Well, this is, a big part. This is always a every budget is transformative in its own way. And, right coming off the heels of the pandemic, we've all realized how healthcare is a cornerstone of both our workforce and our economic development. And it impacts communities all across our state. And Governor Evers is making critical investments within this budget to support working families and address longstanding workforce needs to drive economic growth. And as I mentioned, healthcare is going to be a big part of that and a big component of that moving forward. Next slide. So overall, for those of you who had a chance to take a deep dive, look at the budget, you'll notice that the number at the bottom of the till there is about $17 billion annually. That is a very large portion of this year's budget, as it is every year for DHS, given the breadth and variety of topics that we address year over year as a part of everything that the agency does. So again, that's a very large number. Medicaid's a big part of that. Long-term care, public health, mental behavioral health services, facilities, workforce. It's all contained within that $17 billion figure. And again, everything in there is vitally important and critically important to helping to move our workforce and our economy forward. Next slide. And as I mentioned, what are some of the high-level items? And we're here to talk about workforce today, but do want to highlight a couple of different items in the budget. Again, expanding Medicaid is going to be a critical portion of this budget. It helps us address a number of factors and shortcomings to continue to improve the health and well-being of Wisconsinites across the state. It is something that is vitally important. The savings that come from Medicaid are allowing us to make significant and critical investments in our healthcare infrastructure, workforce, and economy, and want to continue to advocate for that because it's becoming vitally important for us to continue to do that. Additionally, we're working on building our healthy communities, investing in mental behavioral health and crisis services. As many of you have heard, the governor made it very clear in his budget address, this is the year of mental health, and there's over $500 million that are being put into mental health in this governor's budget, Governor Evers' budget this time around. So again, vitally important and very critical investments in our mental health infrastructure. Additionally, we're also making significant investments in long-term care, which is particularly important as we have an aging workforce, aging population, to make sure that we can continue to take care of not just our seniors, but our disabled communities who rely upon these services and these facilities to take care of them in their time of need. And additionally, working to address workforce, which is, again, not unique to healthcare at all. We all know about the shortages, and we'll be touching on that more today. But again, want to make significant sustained investments to bolster and improve our workforce, particularly in healthcare. Next slide. So as I mentioned, again, Medicaid expansion is going to be a key component of Governor Evers' budget for healthcare. It's going to be $1.6 billion in savings if we expand Medicaid, covering up to 90,000 new individuals, or 90,000 individuals, 30,000 of which are currently uninsured. And as of right now, as of last week, Wisconsin is now one of only 10 states that has not yet expanded its Medicaid program. And as we've seen in state after state and study after study and outcome after outcome, states that have expanded Medicaid have experienced significant positive outcomes in terms of people getting access to care, access to coverage, goods and services, hospitals stay open longer, and you actually see an increase in job and economic growth in states that have expanded Medicaid. And by doing so, expanding Medicaid for this budget, it's good not just for the healthcare, but it's good for Wisconsin's workforce because it helps increase the number of people who can find and maintain full-time employment and helps prevent medical bankruptcies by allowing us to get up to that additional 138% of the FPL. And so again, it's not just a healthcare driver, it is a workforce driver, and it is an economic driver. So that is why it's critically important that we expand Medicaid. Next slide. Additionally, from that Medicaid savings figure, as I touched on, that allows us to make significant investments across all of our healthcare infrastructure. That includes improving our public health systems. As some of you may know, Wisconsin ranks at or near the bottom in terms of public health expenditures. And I mean, you know, we rank 48, 49, 50th in the nation in terms of public health expenditures and our investments in public health. And given that we are coming on the heels of the pandemic, it is vitally important that we continue to bolster that and improve our investments in our public health infrastructure. Again, want to make sustained investments in our mental and behavioral health, given this the year of mental health, investing in our long-term care, as well as making sure that health insurance and prescription drugs remain affordable and are made more affordable for Wisconsinites all across the state. So again, we keep saying it, and because we need to keep being said, is that expanding expanding Medicaid is good not just for our health, but it's also good for our workforce and for our economy. And so with that high-level overview, I'd like to turn things over to Mr. Otis Woods to talk about some other budget initiatives in long-term care space and other items there. So I'm going to turn it over to Otis. Take it away.
Thank you, HJ, and good afternoon, everyone. Thank you again for joining us. The long-term care industry has been impacted by the COVID-19 pandemic and is facing numerous challenges from staffing to financial sustainability. This budget makes investments to bolster, stabilize, and support long-term care providers across the state. Home and community-based services help older adults and others who have disabilities live independently in their community by providing help with tasks like getting in and out of bed, personal hygiene, preparing meals, getting dressed, and other activities of daily living. In 2021, ARPA, the American Recovery Plan Act, gave states a temporary 10% increase to the federal matching percentage for long-term care Medicaid expenditures for home and community-based services and required states to reinvest those funds in the HCBS system. This budget provides state funds to continue those investments, including to provide a 5% rate increase and develop minimum fee schedules for home and community-based services. The budget also proposes an increase in Aging and Disability Resource Center funding to keep up with increased demand. Wisconsin's 47 ADRCs and 7 tribal aging and disability resource centers streamline and support access to services for older adults and those with disability regardless of income. With services designed to support people to live in their healthiest and most independent lives, resource centers can address the high rates of health disparities experienced by older adults who are disabled by tailoring programs to meet their specific needs of the community. This budget proposal recommends funding to ensure this service is available to all older adults and those with disabilities and expand caregiver support services to every county. We also introduced a complex patient pilot. The governor's budget also invests $15 million GPR in a complex patient pilot, which aims to address difficulties and delays experienced in placing individuals with medical challenges in post-acute care settings like nursing homes and assisted living communities. The ongoing staffing issues faced by long-term care providers have led to costly delays in discharge from hospitals, and this pilot seeks to find innovative approaches to more timely placement. With the state's population rapidly aging, investments like this one are more critical than ever to ensure Wisconsinites are cared for in the most appropriate setting for their needs. Invest in long-term care workforce. Long-term care workers provide care to Wisconsin's most vulnerable residents. Governor Evers' budget proposal recommends providing funds to increase rates paid to personal care workers and to support the direct caregiver workforce in family care. The governor recommends providing $88.8 million all funds over the biennium to increase the rates paid to personal care workers and an additional $88.8 million all funds over the biennium to increase the direct care and services portion of the capitation rates to support the direct caregiver workforce in family care. It also expands the Alzheimer's Family and Caregiver Support Program. The budget increases the income eligibility threshold from $48,000 currently annually to $60,000 annually. In addition to increasing expenditure authority for existing Alzheimer's disease grant, as well as increased funding for program by $1 million. The governor also recommends providing increased funding to aging and disability resource centers to increase base allocations, as well as investing $13.6 million GPR into adult protective services, which protect elderly and vulnerable adults who are at risk of abuse and exploitation. Now I'd like to turn it over to Ginger to talk about budget initiatives that address staffing and workforce needs from across health sectors. Ginger?
Thanks so much, Otis. Governor Evers' budget makes significant investments to address workforce shortages experienced by every sector of Wisconsin economy. The budget builds upon investments made during the COVID-19 pandemic using federal ARPA funds to support talent development and policy changes to get and keep skilled workers in the Wisconsin economy. Wisconsin healthcare workforce challenges were exacerbated by the pandemic, and the budget invests in long-term solutions to promote staffing across all healthcare sectors. Next slide, please. Governor Evers looks to continue to support the WIS Caregiver Career Program. The WIS Caregiver Careers Program aims to address the shortage of certified nursing assistants in the state by supporting recruitment, training, and retention of qualified caregivers for nursing home residents across Wisconsin. The budget provides for $8 million to increase funding to the program over the biennium. Another initiative is the Healthcare Provider Innovation Grants. The governor's budget recommends $22.5 million over the biennium to establish an ongoing innovation grant program for healthcare employers to engage in improved recruitment and retention of long-term care providers. And lastly, healthcare and public health innovation grants. Governor Evers recommends providing funding to support a pilot project in Dane County focused on addressing the mental health crisis among healthcare workers and recruiting and retaining a sustainable workforce. Next slide, please. Addressing workload demands for quality oversight for long-term care services. To protect the safety of Wisconsinites living in long-term care facilities and to keep pace with the growth in the provider community, Governor Evers' budget recommends providing 11 full-time employee positions in the Office of Caregiver Quality to support misconduct investigations and the background check program. Additionally, the budget recommends an increase in staff who investigate complaints and surveys assisted living facilities and recommends a position to manage the labor-intensive nursing home grant programs. Next slide, please. And within the DHS facilities, the budget looks to expand capacity and fully staff Mendota Juvenile Treatment Center. Mendota Juvenile Treatment Center, or MJTC, is recognized nationally and internationally for its evidence-based treatment model that has achieved significant positive incomes for juveniles with serious behavioral problems. The treatment center currently only serves boys in a 29-bed facility. Governor Evers' budget provides 174 FTE positions to fully staff an expansion of the facility. The expansion will increase capacity at the MJTC from 29 to 93 and will serve juvenile girls for the first time. Another initiative is transferring security personnel at Wisconsin Resource Center to DHS. Security staff at Wisconsin Resource Center, or WRC, are currently administered by both the Department of Corrections and DHS, which really introduces needless complexity and challenges to human resource administration in both organizations. This budget transfers all 110 FTE positions serving as correctional officers at WRC to DHS. This transfer is supported by both agencies. Another budget initiative is to expand the intensive treatment program at Northern Wisconsin Center. Northern Wisconsin Center serves people with intellectual disabilities and currently has the capacity to expand the program. Governor Evers' budget recommends providing 92 FTE positions to expand the intensive treatment program at Northern Wisconsin Center to address the growing list of people with intellectual disabilities who are referred for treatment by the program. This concludes the budget initiatives we are highlighting today, and I'm going to turn things back over to Karen.
Thank you so much, Ginger. We want to just remind you that additional information is available on the DHS website. And as we noted at the beginning of today's briefing, we have recorded this briefing and will provide a link to the recording and slides from today to those who have registered. With that, I'd like to open the floor to questions. And you, again, as a reminder, can use the question box to ask your question. And also wanted to, we do have one question that came in the registration that I'll start us off with. We have a question about how these workforce initiatives were formed in the role that healthcare workers have had in informing them. And Otis, I wondered if you might actually be able to provide a little bit of context for this question.
Thank you, Karen. Hi, good afternoon again, everybody. Previously, the governor's task force on caregiving was tasked with bringing together a variety of stakeholders from the health and community-based sectors to look at the issues surrounding the workforce needs, as well as crisis that providers were experiencing. As part of that task force responsibility, they issued a final report that made recommendations on what the governor and other departmental agencies can pursue in terms of assisting with workforce needs. And many of the proposals in this budget are born out of recommendations made from that task force. As there's a link in the chat here about where you can get that report. But going forward, if there are additional considerations that the department must look into in terms of workforce, we are very open to re-engaging those stakeholders to ensure that workers' voices continue to be heard as they were during the task force activity. So really taking a look at that task force on caregiving and the recommendations they made to the governor on what the state should be pursuing to assist.
Thanks so much, Otis. I am not seeing additional questions in the question box at this time, so I'll work us toward wrapping up for today. Just want to leave you again with that reminder of where you can learn more. We are continuing to build out this website and add additional resources throughout the process, so continue to check back for additional information. And I want to thank our presenters for today. Thank you, Secretary Johnson. Thank you, HJ, Otis, and Ginger for walking us through this focused area of the DHS budget. I also want to thank you for taking time to be here today, for all that you do throughout the state to protect and promote the safety and health of Wisconsinites in your communities. We appreciate you taking your time today. We appreciate your work and your willingness to engage in the budget process, and thank you for joining us today. And with that, seeing no further, oh, wait, hold on one moment. Let's take a look. We have one question. This is a really good question about how the budget initiatives in long-term care affect the children's system. And I am going to ask Andy if you might be able to share a little bit about the budget initiatives that also address the children's system of long-term care.
Yeah, thanks, Karen. Yeah, there are proposals in the GOV's budget that do address services to children as well. So, for example, the $88 million for direct care services for personal care would be to strengthen Medicaid rates for personal care that regardless of the age of the recipient of those services. So that would strengthen access to personal care services, both for adults and for children. The budget also codifies in law access to children's long-term support services. So the budget fully funds the current CLTS program. We have funding in the Medicaid budget to serve all the children that we project would be eligible and would seek services under the Children's Long-Term Supports Program. But in addition, the governor's budget makes it as a matter of law that that DHS must provide services to any child who is eligible and who applies for those services under the CLTS program.
Thank you, Andy. That's really helpful. There's also a question about whether the budget includes growth of the certified peer specialist workforce. And Andy, I wondered if you could help us, help remind us about what, if anything, is included in the budget regarding certified peer specialists.
Right. So the budget does establish Medicaid reimbursement for certified peer specialists for the first time. So that would be an additional revenue reimbursement stream for those services. On the question of whether CPS employers would have access to provider innovation grants, I think that might be an implementation detail. The grants are intended to be available to both healthcare and long-term care providers. So I think our intention is to cast a really broad net for those grants.
Thank you, Andy. All right. Let me again thank you all for joining us today. Thank you to our presenters for walking us through these pieces of the budget. We really appreciate everybody's time, and we wish you a wonderful rest of your day. Thank you.